What do you want to see done about Ireland's green list?
Well, I think simply there shouldn't be one in terms of between Europe and the EU 27 and the UK. We've now moved to a situation where countries like the UK, Germany, Italy are well behind Ireland in terms of infection rates. And Portugal yesterday was actually added back onto the list in the UK. And we should, like those countries at least, should be added back on today. That's what the government said. We have a government that had a report of the aviation task force that has been there since the 7th of July. No movement whatsoever on that. We should get, like, our future as as business people and as a country is intrinsically tied to the European Union and the UK. We cannot do something on our own here. We must get tied in with what they're doing in Europe, and we need to do it now.
Hey, I know you used the word our business in the broad sense there. What about your own business? How much pressure are you under?
Well, in Ireland
with the current situation?
Yeah, in Ireland in particular, like, don't forget, like Ryanair and Aer Lingus, for example, make up about well in excess of 95% of the connectivity in and off this island, and we are and that is private infrastructure. Like, this is the equivalent of ripping up the M50 and saying we don't need it anymore until the COVID crisis abates. We need that connectivity now. We can't do something that is completely different than Europe. We have to do it in conjunction with Europe. And for the last 2 months, we've been hemming and hawing about this country in, this country out. It doesn't work that way.
Yeah, but there'll be people listening who say, but we are different from Europe in the sense that we're an island, and it's impractical in Europe. That's the reason that they allow travel much more freely than we do, is because it would be much more impractical to prevent it. It's much harder to stop people crossing the border between Portugal and Spain.
It's either public health or it's not. It's not about practicalities.
But practicalities, of course, play a role in public health.
The issue here is you got the European... No, it's not. We've got an open border with Northern Ireland, right, which we've conveniently ignored. You can't... We're not an island nation in that sense where you've got another jurisdiction that's completely open through a border like that. It's a nonsense. And the sooner we recognise that...
But that's a practicality putting up against public health.
It's either public health or it's a practicality. You can't have it like... The practicality is we're part of the European Union and we should be open for business, and with the proper health control.
You're more intelligent than that. Give me a break. You weigh practicalities against public health.
It's not. It is not a practicality. We have a border. You either enforce it or you don't. Right? You can't have an ineffective quarantine and say it's all right to come through Northern Ireland, where everybody can land from Brazil, from South America, whatever it is, and make their way through Northern Ireland. It's either public health or it's not. And what we have seen over the last number of months is that hasn't worked, because what we all know about this virus is that when people start to move again, it opens up again and there are clusters. And the answer to that from a public health perspective is isolate and track and trace. And that's what it's about. You can have all the slogans you want. It won't work.